Hi, and welcome to this presentation on authentic leadership in healthy work environments. The purpose of this presentation is really to explore the relationship between utilizing an authentic leadership style and promoting a healthy work environment. Today, leaders are faced with the fact that the healthcare needs continue to rise, but resources continue to decrease. There's not a supply versus demand kind of issue going on. And also we expect exceedingly high expectations for quality outcomes, improved access, and reduction in cost. Authentic leadership and healthy work environments each individually have been proven to be successful, but there really is little research linking them together to show that they can be effective. So this presentation hopes to bridge that gap and prove that it could be a winning strategy in the healthcare setting to provide quality outcomes and also improve and promote positive employee engagement. So the first thing we want to do is look at the state of healthcare today. There's an anticipated shortage of nursing expected by the year 2020, which is only 2 years away. Recruiting nurses continues to be a struggle, and because we have recruiting issues, burnout, turnover, overtime, all of this leads to employee dissatisfaction. In fact, it's alarming that nurses within the first 3 years will actually leave the profession due to job advancement, distress, or different demands. And most importantly, one of the biggest reasons they leave is due to lack of leadership support. With existing shortages, lack of retention, and lack of recruitment efforts or unsuccessful recruitment efforts, a lot of burnout dissatisfaction is occurring, which then obviously leads to increased mistakes. What's even more alarming is in 1999, errors to human was reported by the Institute of Medicine, and that found that 98,000 patients died due to medical mistakes. 10 years later, as the slide shows, 444,000 patients died due to medical mistakes. This is actually staggering because if you think about it, the numbers probably continue to rise. In order to adjust this and in order to make changes, leaders will have to play a critical role in transforming. Research has shown that preventable deaths correlate with dissatisfied nurse in unsatisfactory working environments. Poor relationships affect patient care negatively. Stressful work environments lead to dissatisfaction, burnout, avoidable mistakes, lack of quality of care, and adverse outcomes. All of these things, though, have been proven to be affected by authentic leadership styles and healthy work environment. So if we can come up with a strategy to understand how we can implement both, perhaps we can help to avoid stressful work environments, bad negative outcomes, and also dissatisfied nurse or unsatisfactory working environments. So before we get to the actual idea, what I want to do is take some time to explain what authentic leadership is, healthy work environment, and then we'll go into what I think the solution could be. Shakespeare, one of my favorite authors, in Hamlet, he actually said, "This above all, to thy own self be true." This really was the sole, I think, way authentic leadership kind of comes across. Authentic leadership is grounded in the philosophy of truthfulness, integrity, and honesty. It's about being true to oneself, really taking a look at oneself and how oneself affects other things, how oneself affects the social environment, how you can impact change, how you can impact a team. And it also really takes a look at what is your true moral compass. What do you believe? Do you stick to your beliefs? And it's grounded in the philosophy of doing what is right, not necessarily what is easy. Some of the other qualities that authentic leadership can provide is the leaders are vulnerable, they're willing to listen, they're open, they're positive, they're self-aware. And when I say self-aware, they really do evaluate how they come across to others. They promote open communication, they encourage debate, even when they don't want to necessarily hear what the other person has to say. They're transparent. Sometimes maybe too transparent, but you definitely know how they're feeling, what they're thinking, and what direction they want to go. They also have a resiliency and emotional intelligence and can really learn how to influence others by looking at how other people respond to different situations. They foster innovation, employee engagement. They really work at trusting relationships, and they really work for collaboration. And what happens when you actually have an authentic leadership is you're able to reduce workplace bullying, positive patient outcomes, improve communication. You're able to retain employees, reduce turnover, and overall improve staff satisfaction. But having a leader is just not good enough. Sometimes you also need to have a perfect work environment, or at least a healthy work environment. Back in the day, Florence Nightingale believed that an environment should be aesthetically pleasing, which would then promote healing. And back in the day, she called it a healing environment. Both patients and nurses could benefit from such an environment. It allowed the patients to heal and allowed the nurses to provide care in a healing environment. The name has since evolved to now known as healthy work environments. And a healthy work environment really is a place that is pleasing to all, to the patients, to employees, but allows the employees to be free to, one, provide the care that they need to provide to meet the organizational goals, but they also find that the workplaces are joyful, and it then helps lead to better outcomes and reduces the risk of mortality. There are 6 standards according to the Association of Critical Care Nurses that go into a healthy work environment: communication, collaboration, decision-making, staffing, recognition, and authentic leadership. If you're able to implement these 6 standards, what you will get out of it is reducing workplace bullying, improved communication, improved staff retention, decreasing your turnover rate, decreasing avoidable deaths, increasing recommended hospital, which means likelihood to recommend, and also improving relationships among all, not just between nurses, but between nurses, physicians and non-nurses, managers, every level. It really does create an environment that has been shown to improve outcomes. Up to 9% avoidable deaths can be actually improved with a healthy work environment. So how do you accomplish this? To be an authentic leader, to create a healthy work environment, you would think they kind of go hand in hand. But sometimes, and like I said, the research doesn't show that they are. So what I would like to do is to promote the idea that we create a conceptual framework where we do combine 2 things: authentic leadership style with a healthy work environment. And how we are going to do that is, first, we're going to educate. Leadership is having the knowledge and a clear understanding of what is expected. If we don't teach them what we're expecting, how will they ever know? And I think we can all relate that when you're in a leadership position, sometimes you don't get an education, you learn by fire. So really what we want to start to is our education plan should be scenario-based. It should be based around authentic leadership, current healthcare trends, current issues relating to staffing, what a healthy work environment is, what emotional intelligence is, and to do an evaluation to see if they have any emotional intelligence. Are they self-aware? Do they have social awareness? And do they actually have healthy relationships? Understanding these main concepts are absolutely important for the leader. If we expect the leader to want to act in an authentic leadership, they have to understand what goes into it. If we are able to do scenario-based, making sure that we give them examples of what is good, what is bad, what could be different, might help them be able to adapt. It's not something that someone will pick up overnight, so it will take time and it will take some education, it will take some mentoring from others. The next is we have to go back and create a true north. If a value system is not already created, we need to really go back and help to create a core value. This will give everyone a true north of how we should treat other people, how we should care for our patients, and really how we should run our business. Our values help to provide transparency, truthfulness, mentoring, openness, recognition, and caring. The next thing we got to do is look at process improvement. We have to evaluate what is the current work environment. Are there opportunities to improve communication, decision-making? Are the staff engaged? If the staff are not engaged, do we consider implementing something like Lean? Lean is evidence-based practice with proven outcomes to transform healthcare settings. Lean provides things like huddles, ideas, plan, do, check, act cycles that really allows the employee at every level to be engaged in process improvement and make ideas about what can make their environment more healthy. It also is an exercise in leadership to allow the control of what Lean is supposed to do to rely in the hands of the employee and not so much in the actual leader themselves. So really, if you combine education, you combine values, and you can combine process improvement, do you have an opportunity and a winning strategy to actually create an authentic leadership style with a healthy work environment? If you can, the impact is tremendous. We can reduce workplace bullying, which will help to improve satisfaction. And when I say workplace bullying, I don't necessarily mean nurse to nurse. I mean from provider to nurse, nurse to patient care assistant, or all levels of different nursing, because authentic leadership is one about open communication. So you're going to be improving that communication, hopefully helping to offset some of those perceptions that could be leading to, or in fact, actual bullying. You're going to have improved relationship. You're going to have that camaraderie amongst you all and work more collaboratively together because you're going to a true north, which is what you've established in your value system. You're going to help to improve retention of employees because, one, they're going to hopefully realize that you're a true leader, you're willing to listen to them, you're willing to work with them, you value their opinion, you value their idea because you've now included them in the process improvement process. The other thing is you're going to also then foster innovation. Through the process improvement process, their ideas are going to want to help drive which way we go, whether or not we need to add music to our work environment, or we have to dim the lights to our work environment, or we create a timeout for any kind of interruptions in our work environment. Things that they feel are important that will help them feel like they have a more joyful work environment. and you're going to see collaboration. If you establish things like huddles and you have everyone come to the table, whether it be your primary staff, you bring other staff in, you have all kinds of different people working together towards a common goal, which you've established through your values and your goals, you will find that people will work more willingly together because they understand where they're going, what they're going to, and how to get there. And if they don't know how to get there, they're working together to figure it out. Healthy work environments, what you'll also notice, decreases mortality rates. Because you have process improvement, because you have those ideas and you do allow those crucial conversations, you're going to find where there may be breaks in the process that you can improve upon that will help to impact patient care, which then obviously improves outcomes. Patients that are happy will likelihood to recommend your hospital. You have improved peer relations because you're working together, improved communication because you're talking, and then what you also learn to develop is a blame-free environment. And that's probably one of the most important aspects to point out here, is when a problem does occur or something does occur, you don't go after the who, you go after the what. What happened in the process that caused that to happen? And you look together collaboratively as a team with a true north of what should happen to what did happen and make changes to make it happen. And your changes are really based on the ideas that come from other people. And authentic leadership is allowing those things to occur. You give guidance, you set the goal, but you allow those underneath you to help work towards that. So if you really think about it, conclusion, Shakespeare said it first, to thy own self be true. Florence Nightingale said, we need a healthy work environment to help provide good care, not only for the patients, but also for the nurse. And if you think about it, it really does equal to what I'm going to consider a happy hour. Happy patients start with happy nurses. Happy nurses are a result of authentic leadership, healthy work environment. I hope you enjoyed this presentation. If you have any questions, please feel free to ask. Thank you very much.